Hi, I'm Shawn Skeen. I'm an invasive cardiologist at Waco Cardiology. I have a lot of areas of interest, including heart failure, ischemic heart disease, venous insufficiency, and heart rhythm management. I want to talk to you about one of my favorite things to do because it makes so many people feel so much better. That's implanting a permanent pacemaker. Pacemaker is a medical device that helps people that have symptoms of a slow heartbeat. At Waco Cardiology, we offer both pacemaker implantation in the office as well as in the hospital. Sometimes patients feel symptoms when their hearts go too slow. Their hearts are supposed to beat 60 to 100 times per minute, but the electrical system of the human heart sometimes gets older, or sometimes there are some diseases that impact the heart's ability to beat on its own, or sometimes medications that we give you will impact the heart's ability to beat on its own. That's when a permanent pacemaker can sometimes make people feel significantly better. When you visit us in the office, we're going to talk about what the symptoms look like and counsel you about what the procedure would look like. In the outpatient or the inpatient setting, a lot of times patients go home the same day. You'll report early in the morning. We'll have our nursing staff and our cath lab staff evaluate you, and anesthesiology will usually be involved. Pacemakers are usually implanted in an operating room setting or a cath lab. A small incision is placed up in your shoulder, usually on the left side. It's about 2 to 3 inches, and it's just below the collarbone. After that, we'll make a small pocket which will actually hold the pacemaker and the generator. Using an IV, we'll place 2 small leads that have little screws on the end of them in the top and bottom chamber of your heart. These little screws will implant into the heart muscle itself, which is what helps keep the lead secure. After that, we'll attach those leads to the generator, which we'll then place back in the pocket, and we'll suture up the pocket, usually with stitches that are under the skin that don't have to be removed. In order to help that incision heal, we'll usually place a bandage over it that doesn't have to be removed or changed. We'll keep that on for 7 days, and then we'll follow up in the office to make sure that the pacemaker is functioning normally. On your first follow-up after implantation, usually about 7 to 10 days, the incision will be inspected and the dressing will be removed. We'll usually check the pacemaker again at that time, and then after that we'll be able to check your pacemaker every 3 months from home. You'll be given a device that you can keep in your home or by the bedside that can communicate with the office, so we can check your heart rhythm, the function of the pacemaker, and the battery life. Since we're implanting a pacemaker up in the left shoulder, there is some restriction. That first 7 days after implant, we'll give you an arm sling that you can wear so you can limit your shoulder movement and your arm movement while it heals. We then ask that you not do anything terribly strenuous with the arm for the first 6 weeks. I usually tell people things like, I don't want you casting a fly rod or rolling a bowling ball or hitting an overhand serve in tennis with that left hand. Just let it rest for 6 weeks until the permanent pacemaker actually becomes permanent. I'll usually give you some antibiotics for 3 to 7 days after to make sure that the incision heals well and doesn't get infected. And then after that, I want you to live your life as if that pacemaker's not there. The whole point of the pacemaker is to help you live better and to help you feel better. And when we carefully select the right patients that have symptoms related to their slow heartbeat, people usually do feel significantly better almost right away. Another important advancement in pacemakers is that they're now MRI friendly. A lot of people that need pacemakers also need studies that require MRI. Every company that provides pacemaker coverage for our clinic has an MRI compatible device. Pacemakers have been a real important tool for my practice in helping people maintain their quality of life. And I would love the opportunity to discuss this with you in more detail. I hope that some of this information has answered some of your initial questions, and I look forward to talking to you about it in the future.